Hello, Assalamu alaikum. My name is Dr Danya Bushwereb. I'm a consultant family medicine doctor, GP from UK. Today I'm going to present diabetes mellitus. I'm going to speak briefly about the types, the symptoms, how to spot the diagnosis, what's the treatment, and what are the complications in case somebody doesn't take the treatment. If you didn't come across my channel, the reason behind it is just to speak about common conditions a family doctor will see to increase awareness. So there are a few types of diabetes, but today we're going to speak about the common ones, which are type 1, type 2, and then also you have gestational diabetes, which happens in pregnancy. So what is type 1 diabetes? It's usually the type which comes before the age of 40. It presents in childhood, and it's an autoimmune disease. So the problem with autoimmune diseases, the immune system starts to attack like its own. It starts to attack one of the organs of the body, so it's like a self-destruction, such as like people who suffer from asthma. Asthma is an autoimmune disease, or eczema, psoriasis. Also, there are examples of autoimmune diseases, thyroid, whether it was overactive or underactive. So what happens exactly with type 1 diabetes? So you have like a pancreas. The pancreas, it has like some cells called Langerhans cells. The immune system, which God created it to fight like pathogens like bacteria and viruses, as I mentioned, it's like the army of the body. They start to attack these cells in the pancreas, the Langerhans cells, which are responsible for producing insulin. And insulin, the job of the insulin is to lower down your blood sugar. So when you have the immune system which is destroying these Langerhans cells, which is producing insulin, what will happen? A person will not have insulin at all. So if you see here this picture, the small cells in blue, light blue, these are the Langerhans cells. They're producing like insulin in the blood vessel. So this is a normal. This is a normal picture. But as you can see here, this is an abnormal picture because the Langerhans cells, like the blue one, they become gray. So they're completely destroyed. And as you can see, there's no insulin at all in the blood vessel. So unfortunately, because there's no insulin at all, if a child is having type 1 diabetes, they really need insulin every day. That's mandatory, and it can be life-threatening if somebody with type 1 diabetes, they don't take if they miss taking their insulin, that can be very dangerous. So that can lead even like for conditions like severe dehydration and ketosis. They might end up like in the hospital, being like really sick. So as I said, the main treatment will be insulin. So type 2 diabetes, it's not an autoimmune disease, but it's also genetically, it runs in families. It's usually linked with people who have they have family history of type 2 diabetes. They will tell you, well, my father, my brother, my sister, they might have it. Also, it's linked to obesity and overweight, and following a sedentary lifestyle, like somebody who doesn't do exercise. Exercise is very important. It will help the function of insulin. It will help insulin to work. Insulin, so it works well in our body. It needs to burn, and just to function, it really needs exercise. That's number one. So the main problem with type 2 diabetes, it's there is insulin, but the insulin is not enough. That's the problem. So type 1 diabetes, there's no insulin at all because the cells are destroyed completely. But type 2 diabetes, there is insulin, but as I said, the insulin is not enough. That's number one. Number two, there's resistance to insulin. So what does the mean? What's the meaning of resistance of insulin? So that means the insulin, even the small amount of insulin, which is in like which is produced by the cells in the pancreas, they're not doing their job properly. So the job of it is to lower the blood sugar. So they take the sugar, the glucose from the bloodstream, and then they use it in the cell. They use it in the organs. So when they want to use it in the cells or in the organ, it's completely blocked. There's resistance. So that's a problem, and that usually happens with people who suffer from overweight, who don't do exercise, or even like people who smoke, who may have stress, who have family history of diabetes type 2, like who runs in the family, as I mentioned. or who have high cholesterol or high blood pressure, or even people who fall in category of having of being pre-diabetic. So what is pre-diabetes? Pre-diabetes, it's when somebody's blood sugar, it's not completely normal, but at the same time, they didn't reach the level where you diagnose them as, well, you have diabetes. They're not diagnosed as diabetes, but at the same time, the blood sugar is not normal. And I will show it in one of the slides, what are the normal ranges for the sugar to be in the normal ranges, and what's pre-diabetes and what is diabetes. So there's difference. So what I'm trying to say, that people who are pre-diabetic, if they don't follow a healthy lifestyle, if they don't do exercise, they're at high risk that they might end up having type 2 diabetes. And then you have gestational diabetes, and that's usually 4% of pregnant women. They end up having gestational diabetes. It's when women have diabetes, but usually it happens in pregnancy, and it's quite similar to the reasons of type 2 diabetes. They have insulin. It's not that they don't have insulin. They have it, but it doesn't work very well, like in type 2 diabetes. And not necessarily women who with gestational diabetes, they will end up having type 2 diabetes, but there are some women, unfortunately, with gestational diabetes that are at high risk also of developing type 2 diabetes. But like most women, like with gestational diabetes, with a bit of advices, healthy lifestyle, and follow up with the diabetic nurses, with their own family doctor, and with the gynecologist, they usually end up having a normal life. They don't end up having type 2 diabetes. So what are the symptoms with somebody who is having diabetes? It's they wee a lot. They go a lot to the pass urine. That's the first thing. They would say they always go to the loo. Even during the night, they have to wake up during the night, going to the toilet. They're being very thirsty all of the time. Having weight loss without non-intentional weight loss. That means weight loss without diet. They're feeling unwell most of the time. They feel tired. So these are the symptoms with diabetes. How it's diagnosed? Usually it will be through a blood test. So what your doctor will do, he will ask you for a blood test, which is this one. So you have 3 types of blood tests which your doctor will do. The first one, which is random, not necessarily going to be fasting. So if it's above 11.1, so that indicates there might be diabetes. Or if somebody's fasting, if it's above 7, usually the diagnosis is done over 2 readings, not over 1 reading. And there's another test which they like to do it a lot, which it's HbA1c, and that will give you an indication about the blood sugar over the last 3 months. So that's the most accurate one, actually. It's the HbA1c. So that has to be below 48. Okay, if the HbA1c, if it's between 42 and 47, so that's pre-diabetes. Sorry, I mean HbA1c, it has to be below 42. If it's between 42 and 47, that's pre-diabetes. It's not really, it's not, as I said earlier when I explained about pre-diabetes, it is not normal. When it's normal, it has to be lower than this. It has to be lower than 42. But if if it falls between the above 48 and between 42, that will be pre-diabetes. So that's for HbA1c. But then you have the fasting. If somebody's fasting, if pre-diabetes will be between 55 and 5.5 to 6.9. But the normal one for fasting, it will be below 5.5. So that's how it works. I'm not expecting you to remember these numbers, but usually your doctor will tell you about them. And then other things, the doctor might ask you to have a urine sample. They will dip the urine. They will check if there's any sugar in it, if there's any ketones. And then also we'll check the back of your eye, make sure the back of the eye, everything is fine. And also they might do some other routine bloods, checking the kidney and checking the liver. So what are the complications in case if somebody has diabetes and they're not taking the treatment, they're not adherent with the treatment, they're not compliant, they don't follow their diabetic nurse and all of that? The problem with diabetes on the long term, it might end up having like heart diseases such as heart attack, strokes, kidney problems, even kidney failure. It can damage the nerves in the legs. It's the problem with sensation. People might lose the sensation, and because they lose the sensation, they might end up bumping into even like they might end up having more injury because they bump and they cannot feel the legs. That's the problem. And when injuries, when they are at high risk of having injuries, that can lead to maybe abrasions or even like yeah, they might end up having even ulcers. The problem when you have a broken skin, that can lead to like bacteria to go in like the ulcer or the abrasion or anything. And when somebody the blood sugar is high, that's a good environment for bacteria to grow, because bacteria loves sugar. So people who with diabetes on a long term who don't take the treatment, they're at high risk of, as I said, like having foot ulcers and infections in the legs, fungal infections, and one of the serious complications, they might even having losing their limb, amputation, because the blood sugar is not well controlled. These are like, to be honest, these are like rare complications, and it's usually in people who don't like to take their treatment. But if somebody like follows the treatment and have like regular follow-ups with the doctor, usually they don't end up having these complications. Diabetes, like hypertension, people can live a normal life like the general population, like other people, like, and the risk of having all of these like problems, like stroke and heart problems and kidney problems, nerve, eye, foot, also all of this, the risk will be as if somebody doesn't have diabetes if they take their treatment, if they manage to lower their blood sugar and becomes like within the normal level, then all of this, like the risk of having complications will be like as if somebody doesn't have diabetes. The problem happens when somebody doesn't take the treatment. And the problem with patients who have diabetes, they might end up being burned out, because like it's not easy following sometimes diets and not eating like sugary things, especially when you have like a lot of brands which tell you, well, these are for diabetes, but actually when you read about them, they have like high sugar in it. So who will help with, like, you know, which food choices, and especially if somebody has like a sweet tooth, it's usually like the diabetic nurse. They're quite good in that, and there are even like loads of websites which can help. So diabetes, unfortunately, like any other disease, like any other problem, it can be like threatening. So what's the problem with diabetes? If it's like if somebody's having type 1 diabetes, as I mentioned, they might end up having like severe dehydration, ketosis, and that can be fatal if they don't take their treatment, the insulin, because they don't have insulin at all. That's type 1. And then you have type 2 diabetes. Even type 2 diabetes, if they don't take the treatment, if the blood sugar goes like really high, they might end up having severe dehydration, drowsiness, coma. They might even go into a coma, and can be fatal. So that's why it's important somebody to stick to the treatment. So what is the treatment? First of all, as I mentioned, type 1, it will be the insulin, which your doctor will give you, following the guidelines of the country you're in. If it was type 2 diabetes, the first thing usually it will be weight loss. If somebody's smoking, they have to stop it. They need to check the cholesterol level and try to lower it down. If it wasn't, if somebody couldn't like really lower it down with diet or food, sometimes even giving like a tablet like statins can help. Regarding exercise, the minimum of 30 minutes exercise per day for 5 times a week, that's really advised by WHO, which is organization for worldwide, like for the health. And even like eating, following like a good diet, like lowering in eating like food which is lower in cholesterol and salt and sugar, eating like plenty of fruit and vegetables, and lean meats such as chicken and fish. it's quite good. Regarding the treatment, there are like few different treatments. I'm just going to speak briefly about the treatment. I'm not going to go into details because it's I promise I'm not going to speak about medical terms here. So regarding the treatment, so what is the protocol in UK? So that's the main reason why I opened this channel, to tell people about protocol in the UK, because I've noticed a lot of people, especially when they have a lot of patients, when they have a problem, they get a bit worried and they want to know exactly what's going on. And there isn't that much time for a GP in the UK. They only have 10 minutes. And if they're outside of the UK, sometimes they out of curiosity, they want to know what is the system, what's the protocol in the UK. So that was one of the reasons why I opened this channel. Okay, so basically, the treatment for type 2 diabetes, you have to follow what UK do. Your GP, he's gonna do like the blood test, which I told you about, the fasting, or it was like HbA1c and all of that. And if it's like if it was like confirmed it is type 2 diabetes, and then straight away he's gonna refer you to diabetic nurse. The diabetic nurse will see you. She's gonna discuss with you. If it's like the blood sugar is not very high, most likely they're gonna advise for exercise and lifestyle and all of the stuff which I mentioned about, and then gonna like monitor and see you in 3 months. Or sometimes, like if it's a bit like high, they might start you straight away on drugs. If the blood sugar in 3 months it doesn't get better, and then they're gonna discuss with you the option of starting treatment. The treatment, they follow like a protocol. So the protocol, first of all, they're gonna start with 1 tablet, and then if that doesn't work, they might switch you to 2 tablets, and then if that doesn't work, they might switch you to 3 tablets, and then after that, they might give you an injection, which is non-insulin. And then, if all of that doesn't work, the 5th step, they might start you on insulin. So, in a very simple way, the first treatment, usually they start you on metformin. I don't know if you heard about it or not, but they're gonna start you on that one, and then they're gonna see how things are, because that usually causes can upset the tummy and can cause diarrhea. So that will be the first one. And if somebody cannot take metformin because they have like a chronic, they have like a kidney problem, kidney failure, or anything, like there are other causes of like contraindication in the first line, which is metformin. They might give you other drugs. So these are all of the other options of drugs they can give you. They're gonna give you one of these ones. You're gonna try them. If that doesn't work, and then they're gonna give you 2 drugs which are dual therapy. They might give you metformin and other things like this. And as I said, like if that doesn't work, and then we're gonna go to triple therapy, like 3 drugs. These are called oral hypoglycemic, so they lower the blood sugar. And if that doesn't help, and then they're gonna give you the injection, the GLP-1 agonist injection. And this is like quite recent, like they start using this treatment. It's usually like for people who the blood sugar is high, but also they suffer from obesity. So they're gonna hit 2 birds with 1 stone. So that's what happens. So that's the 4th step. And then the 5th step, if all of this doesn't happen, it will be the insulin. If you're listening and you're from the UK, usually who will look after you, it will be you get referred to diabetic center, and that's where they do all of the bloods, like annual bloods, and they check even the kidney function, they check like everything else, and even they look at your eyes, the back of the eyes, make sure everything is fine. And they will keep like advising you until your blood sugar gets like really well controlled. So so that's the rest of the protocol, which I'm not going to go into details because it's quite medical, but I'm planning to do another video. It will be specific for doctors, and I will speak about the guidelines for medications for diabetes type 2. You're more than welcome to listen to it, but I'm sorry, it will be like full of medical terms and things, because it will be specific. I will speak about medicines and each medicine, what is the side effects. But again, I mean, if you're interested, or if you studied like anything else, like pharmacy or I don't know, other things which is similar to medicine, as I said, like you're more than welcome to come and listen. If there's any questions, please write them in the comments, and thank you very much.